Hello to everyone. Thank you for your patience with our delay in getting things started. You are here in the right spot for the webinar on moving health promotion forward as an accredited discipline. And this is a joint offering between National Collaborating Centre for Determinants of Health and our friends at Health Promotion Canada as part of a series that we've been doing over the past couple of years now, actually, and it keeps building. And so we'd really invite you to check out some of the other webinars in the series. And please, as we're getting going and getting things launched, please introduce yourself in the chat box. Let us know where you're calling from, and let us know if you've got a group of folks with you. There are groups convening in some parts of Canada now to do these kinds of events. So if you happen to be with a group of people, just let us know and let us know how many people are there. So let's get going. Do know that the webinar is being recorded, and as we go through, if you've got any questions, please put them in the chat box and we'll keep track of them for the question and answer period at the end. And also, if you've got any resources to share, any comments to make, any questions or connections that you actually want to make with other participants, we really encourage that as well. And if you see someone or if you want to be connected with someone around this topic, get in touch with one of the speakers afterwards. Our contact information is within the slides, and we can maybe help connect you to some people with similar interests. You're hearing my voice. This is Dianne Oickle, and I'm a knowledge translation specialist with National Collaborating Centre for Determinants of Health, and we are located in Antigonish. And in the background, who is strong but silent, is Danielle McDonald, and she's our research assistant, and she is pulling the technological strings here and does an amazing job. And although you won't probably hear her voice, she is integral to this event happening, and we could not do it without her. And so I want to thank her very, very much for her help. And before we go any further, very importantly, we want to, with respect, acknowledge that we are in Mi'kmaq, which is the ancestral and unceded territory of the Mi'kmaq people. And because we're a national organization, the National Collaborating Centre would extend this respect and this recognition to our Indigenous, First Nations, Inuit, and Métis communities across the provinces and the territories in Canada. I acknowledge this not only in thanks to Indigenous communities who have held a relationship with this land for many, many generations before I ever was here, but also in recognition of the historical and the ongoing legacy of colonialism. And, I think about this every time I do a land acknowledgement and how important it is to not just acknowledge and to not just stop there. I went to a session at the Public Health 2020 conference last week, and a young man named Michael Redbird Champagne spoke in one of the plenaries, and he said, don't just acknowledge, don't stop it at acknowledgement, there needs to be an action. And so his challenge to everyone who was attending that plenary was to accompany the land acknowledgement with an action, because otherwise it doesn't carry meaning. And so the action that I commit to today is to continue to learn and work and to build relationships with Indigenous people and communities across Canada, and to work to understand the way that public health is colonial in its nature, and work to shift some of those colonial approaches, and try and apply those principles of reconciliation and relationship repairing to all of the work that I do. As many of you know, we are one of 6 national collaborating centers. Sorry, I'm just having there we go, slide. I won't say a lot about this. The website is there. I would encourage you to please go there to find out more about each of the websites, each of the NCCs. We are spread across different provinces in the country, and there's lots about each individual on there, including resources to help with public health. Interestingly, the NCCs were born out of the SARS epidemic that happened in 2003, as was the Public Health Agency of Canada, and part of the purpose of the NCCs was to inform public health collective and collaborative action in times of, well, in this case, it was born out of a pandemic, and so it's very interesting to consider that we're in a current global pandemic, and the importance of public health has been heightened, and so we're hoping to contribute to that. And this is a little bit about our center, as well as a link to our website. And again, I would encourage you to go there to learn a bit more about our work. This is what we're hoping to accomplish today, and I would encourage you to refer back to these webinar objectives as you complete the evaluation after the webinar today, and tell us how we did in terms of meeting this. And there's a great alignment between the work that the NCCDH does and the work that Health Promotion Canada does, and that practice of health promotion as a profession, as a designated and distinct profession, and the contributions that that profession can make to addressing social determinants and health equity. So there's a great alignment between the organizations and the fields of practice, and that's what we'll explore today. We have two speakers who will each talk about a different aspect of this. We have Dianne, who's Executive Director for the International Union of Health Promotion and Education, and Christine Priest, who is the Chair of Ontario Healthy Schools Coalition. I'll do a more proper introduction with more details for each of these women when we get closer. And with that, I will transition and ask our most esteemed partner, Irving Rootman, to say a few words about Health Promotion Canada. Irv, are you there?
Yep, I'm here. Can you hear me?
Yes, over to you.
Okay, great. So first of all, I'd like to welcome everybody to the webinar on accreditation and health promotion. We hope that it will help you in making decisions in your careers in the field. Health Promotion Canada is pleased to co-sponsor this webinar with the NCCDH as part of our long-standing webinar series. Can you go to the next slide? Great. The three of us are pleased to represent Health Promotion Canada for this event. For those of you not familiar with Health Promotion Canada, it's a national professional association whose mission is to advance the practice of health promotion. Go to the next slide. These are some of the resources that you can access on our website. And go to the next. And these are some of our activities.